Hello and welcome to the AHIMA Innovation Theater session titled Proactive vs. Reactive, How a Large National Health System Deployed Mobile Technology to Simplify Query Workflow for Physicians. My name is Marisa McClary and I am the CEO of Artifact Health. Artifact Health is first to market with a mobile physician query solution, which was co-developed and launched at Johns Hopkins Medicine in 2016. And is now used by hundreds of hospitals and thousands of physicians across the country to streamline the physician query process. In the interest of full disclosure, Artifact has an alliance with AHIMA. AHIMA has developed a library of electronic physician query templates for use within the Artifact platform, and these templates are updated and maintained by AHIMA CDI and coding experts. I'm extremely excited and honored to have this opportunity to share with you a case study about a large national health system that engaged their providers in query workflow by making it easier for them. They deployed physician query technology to over 60 hospitals during one of the most difficult times in our history. They increased query response rates and reduced query response times with a platform designed for physicians. And they utilized a compliant query template library from a national industry gold standard organization to ensure high-quality, comprehensive clinical documentation. To begin, let's first evaluate the previous query workflows at this health system and identify the challenges they faced and their motivations for seeking a new query solution. From a technical perspective, they operate many different EHR systems across the enterprise, and each one of these EHR systems was supporting its own unique query process for providers, CDI, and HIM staff. Because of these disconnected query workflows, there was no easy way for the health system to view query activity or report on it across the enterprise. And CDI and coding staff tracked queries in different software systems, which created silos of information between these groups. So an effective solution would need to sit across all EHRs and have a shared interface for CDI and HIM staff to collaborate on queries. Another challenge they faced was satisfying providers. At this health system, providers were generally unhappy about their query workflows. They felt queries were time-consuming and interfered with patient care. And as a result, the health system's average response rate to queries was less than desirable, with significant room for improvement. So, ensuring provider engagement was a critical driver in their decision-making. Lastly, the health system recognized that their inefficient query workflows were having a direct and negative financial impact. Therefore, a strong financial case could be made for improving the query process. They had significant dollars on hold because of unanswered queries, costing hundreds of thousands of dollars in interest on borrowed money. CDI and HIM staff spent inordinate amounts of time following up on unanswered queries, and the cost was reduced productivity and the loss in additional charts that could be reviewed, queried on, and coded during that time. And most obvious was the negative impact on quality reporting and reimbursement due to unanswered queries, again creating a strong justification for improvement. So, with these challenges and motivations, the large national health system had to find a solution that could fit their complicated environment. And they had a list of requirements, starting with accessibility. All providers must have access to the query solution at all hospitals, regardless of the hospital's EHR system. Ease of use. The providers needed to find the technology easy and convenient so they would adopt it and become engaged in the query process. Collaboration. CDI and HIM staff needed a combined solution, one system that encouraged a team approach, creating efficiencies between both groups. Compliance. All CDI and HIM queries and physician responses needed to be transparent and visible in the legal medical record. Further, they wanted to ensure that the hundreds of CDI and coding staff across the enterprise were writing compliant queries consistently. And finally, visibility. They wanted a reporting system that tracked query workflow across all of their hospitals, regardless of the EHR, CDI, or coding system used. With these requirements, challenges, and motivations, the large national health system set out to find the ideal query solution, and they chose the industry-leading mobile query platform. You didn't think I'd say they chose something else, did you? They selected the mobile query platform because the technology checked all the boxes to be effective in their complex environment. Having many different EHR systems, they also knew the implementation and deployment approach would be critical to success. So they valued the mobile query vendor's focus and commitment to customer support. For the enterprise-wide implementation, the health system assembled a multi-stakeholder project team comprised of leadership from CDI, HIM, clinical operations, IT, and the vendor. Looking back on this project, it was one of the best examples of a collaborative, team-oriented, vendor-customer partnership I've ever been a part of. I think this was because of the people and their mission-driven attitude and the challenging time we were in. We kicked off in early February, and the project team was able to bring 20% of the health system's over 60 hospitals live on the mobile query platform right before COVID hit in mid-March. COVID caused an unprecedented upheaval for hospitals across the globe, and for this national health system, hotspots seemed to spring up in nearly every region they operated hospitals. Like almost every U.S. health system, they enacted immediate cost-cutting efforts, flexing and furloughing staff and pausing IT deployments, which was the case with our project. At that point, the project team pivoted. We shifted our focus away from implementation to working solely on the technical integration, which the project team could do working from home. And we waited to see what would happen. During the months of April and May, the project team integrated the mobile query platform with all the AHRs, as well as the health system's coding and CDI systems, so that query information flowed to the proper places. The team provisioned nearly 30,000 users to use the query platform. And we created direct integrations with nearly all the EHRs so that providers would have 3 ways to access the query platform: from their mobile device, from the web, and directly from within the EHR. Meanwhile, that first group of hospitals that went live in early March, right before COVID hit, they were doing really well. The bar graph shows a dip in query volume in March from the average monthly query volume in 2019. But the volume begins to climb in April and May as CDI and HIM staff created more queries. We believe this is due to the efficiencies gained with the query platform and the fact that CDI and HIM staff no longer needed to spend time following up with physicians on unanswered queries. Therefore, they could review and query on more charts. Simultaneously, the line graph shows that average physician response time was decreasing. By May, physician response time was cut in half, down to less than a day. Because of the faster response time, accounts on hold for this group of hospitals decreased by 69%. So despite COVID, CDI and HIM staff were reporting high physician satisfaction and easier workflows. Many CDI staff had transitioned to working from home, and they explained how extremely grateful they were to be able to maintain physician engagement and high productivity using the query platform. Those CDI and HIM staff that remained on site at the hospitals reported that providers were finding responding to queries easy and fast. And by mid-May, the large national health system decided to restart the rollout across all the remaining hospitals. So the project team, we reconvened and we asked ourselves, could we adjust the deployment approach to be successful? Could we ensure the safety of the project team members traveling and working on site? Would providers have the time to adopt a new technology given the surge in COVID patients at these hospitals? So here's what we did. First, we set a key priority to not cause any interference or disruption to clinical operations. Secondly, we changed the deployment approach to be extremely responsive and extremely supportive by breaking down the remaining hospitals into small groups and creating more frequent go-live events. We scheduled 12 go-live events starting at the end of June and finishing in early September. This meant the project team was traveling to hospitals in a region and supporting a go-live event every week of the summer. Third, we trained all the CDI and coding staff remotely using an online self-training module. The providers do not require training as the mobile query app is designed to be easy and intuitive. Fourth, we organized physician advisors at each hospital to be responsible for assisting with provider communication beginning weeks before the go-live event and extending ongoing as a resource to physicians. Fifth, we assigned 2-person teams to each hospital, and the teams were comprised of 1 vendor and 1 customer team member. And each 2-person team was on site at its hospital go-live for 3 days and responsible for assisting CDI and HIM staff with creating their first queries in the system, reviewing reports, meeting with leadership, and communicating with the providers about the new workflow and access to the query platform. Sixth, we put safety protocols in place that dictated where the team members could physically be in a hospital. And we also conducted frequent COVID testing of team members to ensure everyone's safety. And finally, at Go Live, we auto-delivered real-time reports to keep leadership informed of the status of queries and the project's success at each hospital. By creating this high level of visibility, it allowed everyone to quickly identify hospitals and individuals that needed support. At each of the 12 go-live events, the user feedback was positive. I recall meeting with a coder to train him on the query platform. He had a query that he had placed in Cerner earlier that day that was still pending. We went through the process together of recreating that query in the new system, and in 2 minutes the doctor answered it. It was moments like this when you see the smile on someone's face and you know you made their life a little bit easier, and that makes it all worth it. The providers, they always had the same reaction to us. They would politely ask, "How much time will it take you to show me this query thing?" And within a few minutes, we would be done showing them, and often the doctors would linger asking more questions because they couldn't believe how quick and easy it was. One thing we found really interesting was providers were responding at all times of the day. This histogram shows a broad curve with peak response times when query notifications are sent out midday. The only times providers are not really responding is between 1 and 4 in the morning. I think this data demonstrates that if you make the workflow easy and accessible, they will respond when it's convenient for them. Also interesting, the vast majority of physician responses come in within the first 0 to 12 hours from the time the query is sent. And if we zoom in on that 0 to 12 hour group, the vast majority of physician responses come in within the first hour from the time the query is sent. The large national health system gained greater visibility into the query process. For example, this report displays query template counts over the last 90 days for the enterprise. This helps them understand which areas they are sending the most queries and where further education could be needed. Soon they will begin delivering education through the mobile query platform to providers on the top 10 areas. In the end, this large national health system made decisions that proactively positioned them for this new normal set up by the pandemic. They relieved providers of a time-consuming administrative task when providers needed more time to care for patients. And they did it in a way that was non-disruptive and ultimately created stronger provider engagement in the query process. They were able to increase productivity for the hundreds of CDI and coding staff. They gave them a tool that eliminated time-consuming query follow-up activity. And the tool allowed them to maintain strong provider engagement when they were forced to immediately transition to working from home because of COVID. Also, they now had an effective query process in place to financially recover from the disruption caused by the pandemic by capturing proper and full reimbursement for services and reducing accounts on hold. And finally, at a time when hospitals have a paramount public health responsibility to document and report patient data as accurately and comprehensively as possible, they collaborated with the experts at AHIMA to standardize compliant query workflow and ensure high-quality, comprehensive clinical documentation. AHIMA developed a compliant physician query template library for use within the mobile query platform. The standardized query library helps CDI and coding staff compose compliant, high-quality, and well-supported queries. I appreciate your participation today, and I look forward to answering any questions you might have.